eardrops, pills at CVS or Walgreens, the pharmacies that are labeled for tinnitus. The FDA has approved none of those things, and quite frankly, they really don't work.
Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today my guest is Ben Thompson, who is an audiologist. And today we are talking about tinnitus and hearing loss. Thank you so much for joining me today, Ben.
I'm so glad to be here. Excited to share my knowledge on tinnitus and hearing loss.
So, before we get into this, would you mind telling our audience a little bit about your background?
Absolutely. My name is Dr. Ben Thompson. I'm an audiologist who trained at UCSF Medical Center in San Francisco, California. I've been trained by pioneers in tinnitus treatment, and some people do say tinnitus. Both pronunciations are okay. I was trained by some of the pioneers in tinnitus treatment, including Dr. Pavel Jastrzeboff, founder of tinnitus retraining therapy. And currently, I run Treble Health, which is a telehealth practice focused on tinnitus. And we've treated over 1,500 patients through telehealth since launching in 2020 with a success rate of 85%.
So, where can people find you online? I know you have a YouTube channel as well as a website. Well, would you mind mentioning those?
Absolutely. Yeah. Before we get started, treblehealth.com is the telehealth practice that I run. And if you search Treble Health on YouTube, we have over 100,000 subscribers there.
So, can any state work with that? I don't know how audiologists work.
Yes, we have licenses in all 50 states. So for a patient who needs help with tinnitus, they can have a telehealth consultation with one of our doctors to help them out with their ears.
Sure. So, we're going to start talking about hearing health. So, what are some of the most common hearing issues you encounter in your practice?
The most common would be age-related hearing loss. So what research has shown is that it's not necessarily the aging process that creates the hearing loss, but it's that all the years that we're exposed to life is that life can be pretty noisy. So over the years, the buildup of noise exposure is actually most correlated to that age-related hearing loss, which we call presbycusis. Additionally, there are more sudden cases of noise-induced hearing loss from loud noise exposures, and tinnitus, ringing in the ears, is also very common. Tinnitus is often the first symptom of hearing issues for people, so hearing ringing, buzzing sounds in their head. And there was a research study in 2020 by Lynn that found the prevalence of hearing loss rises with age, and it affects about 1 in 3 adults over 65 years old.
So, can you explain how age-related hearing loss differs from hearing loss due to other causes like just noise exposure?
Absolutely. The symptoms that my patients have with age-related hearing loss is they start to notice the clarity of speech isn't what it used to be. They might be told that they're having to ask others to repeat themselves. They might be turning up the television volume just a bit because it's not as clear as it once was. They may think people just mumble more than they used to. So those are some of the most common symptoms of hearing loss. And age-related hearing loss is gradual, usually occurs in both ears together. Sudden hearing loss from loud noise or noise-induced hearing loss is often more acute, and it can be worse in one ear over the other. There was a research group, Doby et al., in 2019 that did confirm that noise exposure can result in hearing loss across all age groups.
Sure. So, I have a question. Some reason, how come in the morning, like I want everything like turned down way more, and then as the day goes on, I'm usually fine with higher volumes on things.
Mike, I think that is more of a personal preference than any sort of diagnosis.
Sure.
And I would say that most people prefer calm, relaxed mornings. I think
Sure.
that's essentially how we're wired.
So, how can people maintain a healthy hearing as they age?
The most important thing to do in terms of preventing further hearing loss is being aware that some noise, generally above 85 decibels, can be dangerous. So prevention is keeping your ears healthy. So whether you already have hearing loss or not, limiting loud noise exposure, commonly around chainsaws, around power equipment, certain loud engines, loud music. Those are some of the most common things, as well as gunfire, things of that sort. Wearing hearing protection if you're around those. It's totally okay to go to a loud concert. Just get some good earplugs and use them. Also, if you're above 65, I would certainly recommend getting a hearing test if you haven't already. For people who turn 50 years old and are trying to be the healthiest versions of themselves possible, I would recommend regular hearing tests, but definitely if you're 65 or older. In 2021, there was a study by Gates et al. That found that regular hearing tests improved the early detection of hearing loss, and recent research has linked hearing loss to cognitive decline and brain health. Hearing loss was actually listed as one of the most important modifiable risk factors for cognitive decline. So it's been shown that you can prevent changes to your brain, negative changes like cognitive decline, potentially dementia, and things of that sort by treating hearing loss. So really important and I think relevant for all of our listeners.
So I want to focus on tinnitus now. So what is tinnitus and how can it present itself?
I am so passionate about helping people with tinnitus. Unfortunately, here's the situation for people who have ringing, buzzing, or hissing sounds in their ears. Um, they notice it and it's alarming. So they go to their doctor, and most doctors rule out a medication or a surgery as a viable option. That doesn't apply to 99% of tinnitus cases. And most people are met with the difficult news by an ENT doctor that says, look, there's not much you can do for tinnitus. That creates stress, anxiety. It makes the sound of tinnitus often worse and louder. So, one of the most important things we can do is educate people on really what tinnitus is and when it's a problem versus when it's just something happening in their body that will get better. Um, McCormick et al., in a research study in 2016, found that tinnitus affects about 15% of the adult population worldwide. And in my experience, about 1% of the population has very bothersome tinnitus. So, Mike, if you were to go and tell everyone that, oh, you work as in the tinnitus field like I do, what I've found is that so many people say, wow, I have really bothersome tinnitus, or my spouse or my family member really struggles with this. But because it's an invisible condition, it's not talked about that much. Uh, but I'll say it's very important, and there are a lot of things we can do to improve it.
So what are the root causes of tinnitus?
The root causes generally break down to three main categories. Number one is hearing loss related. We call that cochlear, relating to the cochlea, the hearing organ. And I'll actually show you right here on the screen for those of us who are watching on YouTube or on video. I have an ear diagram, and you can see right here that this is the actual inner ear. So this is the outer ear into the eardrum, and then eventually back to the hearing nerve, and we have this capsule, which is called the cochlea. This has those small cells which can relay pitch information through vibrations of sound all the way up into the brain. For most cases of tinnitus, there is some hearing loss. Research has found that about 90% of people with tinnitus have at least some degree of hearing loss. So part of tinnitus, the root cause, is related to the ear. The second most common root cause would be the central nervous system. We call that subtype or root cause, we call it the central subtype. Stress has a big part of this. It's common that someone can experience a rather sudden tinnitus, and it's related to a period of stress in their life. Let's say 2 months leading up to a time period, there was interpersonal stress, there was work stress, there was family stress, there was a lot of focus on health and some health conditions that were going wrong in their body. All of these things can actually sort of manifest as tinnitus. The third major subtype would be somatic or somatosensory. That's most commonly linked to issues of the jaw, TMJ, or the neck, where there's a part of the brain stem where the nerve for the somatic system, neck and jaw, is essentially the neighbor of the auditory pathway, the auditory neurons. And there can be some crosstalk between those areas where severe issues with TMJ can lead to an audible sensation of tinnitus. So, Mike, in your work as a physical therapist, neck issues, cervical spine issues, jaw tightness, TMJ, there isn't an obvious link for the average person that would lead to an auditory symptom. But once we investigate further, we can actually find that some cases of tinnitus are caused by physical issues. And those are the three main root causes of tinnitus.
Huh. I've never heard of the TMJ issue related to audiology. That's fascinating. Anyway, can you explain the differences between subjective and objective tinnitus?
Yeah, it's pretty simple. Subjective tinnitus is when only the patient can hear it. And that's the most common type of tinnitus. Objective, which is very rare, is where you can actually measure sound generated inside of the body. Certain kinds of pulsing, like pulsatile, heartbeat related cardiovascular tinnitus can be measured. But there was a 2013 study that found that less than 1% of cases present with that objective tinnitus.
So I have another personal question. Oftentimes I can hear everything fine, but if I'm in a crowd and talking to one person, I swear I just hyper focus on the background noise and not the person talking to me. Is that just like in my mind doing that, or is that like a hearing loss issue?
It can be a hearing issue. It's not necessarily that something is wrong, right? Because for everyone, we have a threshold of a certain amount of background noise makes it difficult to hear clearly. But even if you got a hearing test and it showed that your hearing was overall normal, there could be something related to the processing of sound. And I wouldn't go so far as to say that there's anything wrong with your system per se, but there are more subtle types of hearing issues that make it hard to understand speech and background noise. So, how bad is it for you? Just curious.
It's not terrible, but if I'm at an event and there's like a lot of people, like I know I'm supposed to focus on the person. I think I get in my own head, and then I'm like, I heard about half of that. Now I'm lip reading. But when I was younger, like I used to, I mean, I am involved with music as well. But when I was younger, like obviously you're young, you don't wear earplugs. But I learned pretty quickly, like at age 20, that I need them because there was many concerts I'd come home from when I was younger, and my ears would be ringing. So
Yeah, we're getting closer to what's happening here, where musicians or people around loud noise often do experience the loud noise exposure, right? The going to concerts, and that can have an effect. The, the tricky thing with the ears is that there's somewhat of a delayed effect for loud noise in terms of hearing loss. So what could have happened 10 years ago might just be now sort of manifesting of a little harder to hear in a background noise situation. Now, if you sort of track the 5, 10, 20 years down the road, um, you could see at some point someone like you who says, actually want some help. Is there any technology that can help me? And there are lots of options for hearing technology. In your case, I would say we would think more from a more simple perspective, but for someone who's having a serious problem, there's different technology they can wear on their ears, hearing aids, other devices, etc., that can try to reduce that background noise and make it more clear to hear the person in front of them.
sure. No, yeah, we'll get into that a little bit later too. I was just curious. Anyway, back on
Absolutely.
the tinnitus. So, what are some environmental factors that can worsen tinnitus symptoms? Obviously, I'm assuming outside noises that are consistently loud.
Sometimes loud, sudden noises, let's say you're walking down the street, you're trying to be peaceful, and there's a surprise honk, like if you're in New York City, just honk on the horn. That can exacerbate tinnitus for hours or even days. Um, Other things, I would say the biggest two would be stress. We all go through stress. We can't avoid that completely, but we can try to control it and manage it. The other piece would be lack of sleep. So people with tinnitus have a higher rate of insomnia because think about it, when you're trying to fall asleep in a quiet place, that's a hard situation to take your mind off of this loud, persistent ringing. I mean, like it's really hard to imagine what our patients go through. Um, what our patients go through is that for most of the day, they hear this constant ringing. And not, we have people who come to us and say, 80% of my waking hours, I'm aware of this intrusive, annoying, sometimes loud sound. So it's definitely a serious problem. Sleep is important, concentration and focus during the day, and even anxiety management. There was a research study in 2019 by Hesser et al. That found that stress and anxiety can significantly increase tinnitus severity. So it's more than just an ear issue. It's often a whole person issue, and something that we work with patients on is addressing the mental and emotional part of this, which when we get that right with certain sound therapy treatments, that leads to success with tinnitus and reducing it over time.
Sure. So, what are some of the latest evidence-based treatments for tinnitus?
Yeah, great question. So there's a few treatments to consider. I would say they are tinnitus retraining therapy, cognitive behavioral therapy, and bimodal stimulation. So what these approaches do is they try to address tinnitus by going through certain neural pathways or certain parts of the brain, you can say. Cognitive behavioral therapy, which in 2020 showed a significant efficacy in reducing tinnitus related distress, really addresses the mental and emotional pathway of tinnitus. That if we can retrain the brain to react and respond differently, then the tinnitus can get better and reduce over time. Tinnitus retraining therapy, where I had one of my mentors, my main mentor, Dr. Pavel Jastroboff, is the founder of tinnitus retraining therapy. I had one of my patients refer to him as the grandfather of tinnitus research. And really, what this approach that he created did is it showed the world, over the last few decades, that tinnitus is not only an ear issue. And to treat tinnitus properly, we need to elicit this brain response called habituation. What that means is if the brain can reduce the awareness of tinnitus over time, then often the volume can reduce as well. Think of the sound of our breathing. If we stop right now and listen for our breathing, take an inhale and an exhale at a normal rate, we can hear that sound. So that means it's always there, right? But your brain never thinks about it. So what this shows us is that the brain can filter out different body sensations, like the feeling of clothes on our skin. It's there, but we never think about it. The heartbeat inside of our chest, you can often feel that when it's subtle, or the feeling of the chair that you're sitting on. So, from a neuroscience perspective, tinnitus retraining therapy showed us the power of habituation, the ability for the brain to categorize tinnitus as a benign body sensation and eventually over time make it go softer and softer and softer. And finally, I'll mention bimodal stimulation, a double-blind study with 99 participants published in 2023 found that after 12 weeks of bimodal stimulation, where there was some electrical pulses going between the cheek and the neck, and then sound going through a little tip in the ear, when the pulses from the cheek and neck and the sound going through the ear were presented over time simultaneously, it provided a significant reduction in tinnitus symptoms for a majority of adults with that somatic tinnitus. That research is coming from Dr. Susan Shore's lab. So those are really the approaches that I would recommend most people to consider. And unfortunately, Mike, people are often trying things that don't work, like herbal supplements, uh, you know, gimmicks that they find online, ear drops, pills at CVS or Walgreens, the pharmacies that are labeled for tinnitus. The FDA has approved none of those things, and quite frankly, they, you know, at a whole, really don't work and aren't recommended. But these approaches, what I mentioned, the CBT, that more psychological piece, the tinnitus retraining therapy, which is the gold standard approach that's been used consistently by specialists, and then this newer approach, which is we're still learning more and more about its effectiveness, bimodal stimulation. Those are the tinnitus treatments that are available that I want everyone to know about.
So, are there other tinnitus treatments? Because I know when I looked it up, it said like sound therapy and hearing aids can help manage it. Is those some options as well?
Absolutely. Sound therapy is the use of specific sounds like a white noise or nature sounds or specific sounds that are played either through a sound machine, like you can see that I'm holding right here, a high quality sound machine. Additionally, through some hearing devices, like I have for those of us who are watching on video, you can see this is a hearing device which can be programmed just for tinnitus or for hearing loss as well. If someone has hearing loss and tinnitus, then we would use this device, which is essentially a hearing aid. And when those are set up properly, that is a big part of the treatment. So the tinnitus retraining therapy that I mentioned, one of those pillars is the sound therapy treatment through devices like this on the ears most commonly. And absolutely, Mike, for people who are looking for, say, the low hanging fruit or the big opportunity to really move their tinnitus, shift it, have an effective treatment, consistent sound therapy is one of the primary tools.
Sure. So, we're going to start talking about hearing loss prevention and treatment now. So, noise induced hearing loss is a big issue, obviously, especially if people use headphones all the time, as I'm wearing some. What advice would you give for preventing this?
Yeah, so the work that I do at Treble Health, we're focused on tinnitus treatment. We also interface with people who have hearing issues or want to protect their hearing as well. So preventing noise-induced hearing loss is something to keep in mind. Um, Frequent headphone use is generally safe, but we have to consider how many hours are you listening to it and what's the volume. As a general rule, try to keep the volume below 60% on your volume dial. Try to keep it below 60%. Take breaks and just remember that loud noise, very loud through your headphones consistently for many hours a day, every week, that can lead to hearing loss. And we don't want that. We want to keep you healthy and have the best hearing and the best brain health for as long as we can. In 2021, there was a study by Kumar et al. That found that prolonged headphone use at high volumes can cause permanent hearing damage.
Sure. Yeah, I have Apple products and my when I listen to music, my watch will say it'll tell me like you're listening too loud, turn it down. Like it measures the decibels. And then my watch also like of outside noises, it'll pick it up too. So I kind of find it interesting all our gadgets are picking up on these tips now too.
I love it. I love it.
Although I will admit, the watch is kind of annoying because if I just take a shower, it must be the water hitting it hard. It thinks that's loud every time.
We got to
Anyway,
change that. But Mike, you got to take less showers. They're too loud. Okay.
I guess I could just take my watch off and wouldn't worry about it. It always tells me to, and I'm luckily you can mute it because if I'm at band practice, I'm like, well, I have headphones on. Like, obviously your
What
watch doesn't
instrument
know
do you
you.
play?
I play the drums, which are loud,
No wonder you've experienced
and it's
some hearing
very
issues.
loud music.
What
But
kind of music? Like rock or
oh,
things like
it's like
that?
it's metal music.
Okay, so possibly the loudest music there is.
Yeah, possibly. Yeah. I mean, I always wear earplugs at a pretty young age. Now we have in-ear monitors, so obviously I control how much volume I get going into them. But yeah,
All
I
right,
have
well,
to
I
turn
see
it
why
way
you
down.
invited me to be a guest here. There's some
Just want to fix
personal
my
help.
old issues. I'm sure I have hearing loss. Our bass player also works for this company, and he has tinnitus, so I'm not that bad. You played music, didn't you? I thought you told me that.
Uh, yeah, I played music, guitar, singing, and a lot of people in the audiology world, hearing tinnitus world do have a hobby or a passion for music, I would say even more of them just enjoy going to shows, right? So it's one of the things that bring a lot of joy and happiness in our lives is going to concerts. So we definitely want to keep our ears healthy so that we can keep doing that.
Yeah, I luckily had pretty good instructors. My parents were very adamant about me wearing ear protection at a young age. So luckily, those few teenage years I was rough, but I've I've matured in that realm at least. Anyway, back onto the subject matter. How do you determine when someone needs a hearing aid?
First step would be getting a hearing test. The second would be reviewing that hearing test with a professional who really understands all the options available. Uh, there can be a range of technology products that can help someone essentially treat their hearing loss. And as we mentioned earlier, the research showing that hearing loss is a risk factor for cognitive decline im- has given professionals the clear confidence to say, hey, this is good for your brain to treat your hearing loss. Yes, there's benefits to hearing people. Yes, there's benefits to having your spouse or your family not have to yell or raise their voice, but also take care of your brain. And what the research there showed was that those patients who do treat hearing loss with some modern hearing aids that are sleek, sound quality is great, they're easy to use, rechargeable, connect to smartphones, um, that those devices, when programmed appropriately, can do a great service to helping people with hearing and wanting to keep healthy later in life, which I know your channel and what you guys do is really, I think, one of the best resources for healthy aging in the body. And we know the body is linked to the mind. It's really all one piece, right?
Yeah. So, speaking of hearing aids, what technology has changed over the years that people may not be aware of?
Rechargeable batteries are a great tool, Bluetooth connectivity, and then background noise suppression. Um, Everyone knows someone who's worn hearing aids where they've had to deal with small batteries or just fussing around with the difficulty of using them. The more modern devices, which essentially are in the last 15 years, so basically 2010 and after, they're sleek devices and they have rechargeable batteries most often. The devices also connect to Bluetooth. And for example, if someone has an iPhone or an Android, you can listen to this podcast through your hearing aids. You can take a phone call through your hearing aids. You can adjust the settings like sound quality and volume. Each ear individually, you can adjust all that through an easy to use app on your phone. And then finally, probably the most important is the improvements in sound quality and noise reduction technology. So that situation you spoke about, Mike, imagine if not only it was hard to make sense of the words someone was saying with the background noise, but imagine you also were hearing someone at a hearing loss. Imagine if the actual input was distorted as well because of your ears. That would present a very difficult time to make sense of the signal versus the noise. And essentially, what the technology does is it tries to focus on the speech in front of you that you're trying to pay attention to and suppress the background noise coming from all other sides.
Sure. Huh. Do hearing aids kind of vary depending upon like your hearing loss issue, if it's tinnitus or something else, or do they kind of just work either way?
The actual device, so I'm holding one of the devices that we work with a lot at Treble Health with our company via telehealth. The actual device itself can work either just for hearing loss, which is most common, in society that people use these devices, hearing aids, for just hearing loss. But when someone has primarily a tinnitus problem ringing in their ears, then the doctor on our team, for example, can program and change the settings, just like when the DJ is changing the sound quality, more highs, less lows, more treble, less bass, etc. The doctor can adjust the hearing aid settings based on the individual's needs, based on their hearing test, which shows how well can they hear it in each frequency or pitch range. So they are customized and fine-tuned based on the individual hearing profile.
Sure. So, can you talk about the role of hearing protection in noisy environments? Like what type of headphones or earplugs are optimal?
Absolutely. Yeah, it's first important to say that there was a research study in 2020 by Taylor et al. That found that custom earplugs reduced noise-induced hearing loss by up to 30%. Therefore, for anyone who wants to protect their hearing, which in my opinion should be almost everyone, but especially if you have some signs of hearing loss, especially if you have some signs of tinnitus, this is the main way to prevent further difficulties. No one wants their hearing to get worse. No one wants their tinnitus to get worse. They're already pretty difficult conditions to deal with. So using earplugs around very loud noises has been proven to work. Basic earplugs would be foam earplugs. Probably remember these, or those bright yellow or sort of pink ones. Those are good. Those can work. So definitely use those if those are available. Additionally, you can go to an audiologist, go to an audiology clinic, and you can ask them to take ear molds. I'm serious when I say this. In 5 minutes after we're done here, uh, I'm going to a colleague just a few blocks away from where I am in California who's going to take some ear mold impressions for me. And with those, I can order any types of earplugs. So you can order them for sleep if you're just trying to sleep in a quieter room. You can order those for music and loud noise with different decibel ranges. So do you want to have it just a little quieter, or do you need the maximum protection like you're playing drums in a metal band? I'll be using my earplugs for surf earplugs. So I surf a lot in the cold water, and there's a condition called surfer's ear, which I'm trying to prevent and get ahead of, where if I use these earplugs consistently in the cold water when I go surfing or swimming, then I will reduce the surfer's ear. What surfer's ear is inside of the ear canal. So right here, I'm showing the ear again on video. Inside of the ear canal, there's the bony part right before the eardrum. And inside of this ear canal, the bone, when it's exposed to cold water significantly, the bone there can protrude out and essentially try to close the ear canal. And that can create a lot of problems for surfers, like problems with water getting stuck in their ear, leading to an ear infection, problems with hearing loss, problems with earwax being impacted, just some nasty stuff. So all the surfers here in Northern California, most of the older surfers are using the earplugs, not necessarily because they want to, but because they kind of have to.
Oh, is that kind of like swimmer's ear? I've heard of that.
Swimmer's ear is an infection of the ear canal. That's generally a bacteria infection of the ear canal. That's more, say, if you swim in a river and there's some bacteria that gets in there, and it's sort of like this cave in your ear canal, and the bacteria can grow and create some pain. This is different. This is more of a bony growth in the ear canal related to cold water exposure.
Sure. Okay. I had that when I was a kid. I just remember I had to take ear drops a bunch for it. It
Yeah, that one's
leak.
relatively easy to fix, easier than the surfer's ear.
Sure. So, are there any early warning signs that someone needs to get their hearing checked?
Absolutely. If you're listening and you know someone, maybe it's you, but if you know someone who has trouble following conversations, they need to increase the volume on the television or other devices, they ask others to repeat themselves, um, they're noticing speech sounds a little less clear, they're having to sort of strain and lean in to try to hear. Those are all signs that someone may have some hearing issues. And I'd recommend going to a audiologist, a doctor of audiology, who is the specialist in hearing loss. You may also see an ear, nose, and throat doctor if you go to an ear ENT clinic, and we can do an evaluation to determine what's going on with your hearing. Is it appropriate for your age? and what are the treatment options available to stay active, hear your loved ones more clearly, and not be that person who has to ask others to repeat themselves. There was a research study in 2019 by Simpson et al. That found that adults often delay seeking help for hearing loss by up to 10 years. So let's try to be, the minority here and be proactive with our health so that we're not delaying the negative effects of untreated hearing loss.
Yeah, I've worked with plenty of patients that tell me they have hearing loss, but they haven't done anything about it. I just get to
Well,
yell
now,
more.
Mike, now you have the responsibility to
Tell them to go
direct
see
them
Ben.
towards next steps. Yep, tell them to come see Ben. I'll take care of them.
Is there? I'm assuming it just has to do with growing, but is there any correlation between like having lots of ear infections and hearing loss? I'm assuming not, because that's more bacterial infection, isn't it? Or is that something different?
There can be. So earlier we talked about swimmer's ear, which is an ear infection outside of the eardrum.
Mhm.
The more dangerous, we'll say, ear infection is inside of the eardrum because it actually creates a hearing loss in addition to a risk of some pretty serious, you know, long-term bacteria or long-term infection effects. So this is where most commonly in pediatrics, so children who are under 2 years old, it's pretty common for them to be sort of tugging their ear and kind of crying and putting attention to their ear. And then they go into the doctor and we realize, oh, they actually had an ear infection. That's why they were fussy. And there's also a correlation between delayed speech development because they couldn't hear those soft sounds that are necessary for them to develop speech. Children who have chronic ear infections do sometimes have a serious long-term hearing loss going on. But generally speaking, with modern medicine, if you go to the doctor and you get evaluated when you have symptoms, ear infections won't cause a long-term issue.
Sure. I had them all the time as a kid. It was annoying. Anyway, last question. How do hearing issues affect a person's overall quality of life, including mental health and communication skills?
So much. I mean, what is life without hearing people, without understanding your loved ones, without connecting with a stranger, with connecting with someone you meet? I mean, this is the fundamental part of being human. This is why our civilization has advanced, that we can communicate, we can understand what someone's saying, we can make plans for the future. We can empathize with someone because we really hear and feel what they're going through. So hearing is the fundamental fabric of life and of society, of relationships, of love. So to put your hearing first is really taking care of you and all those around you. On the more risk side of things, there's an increased risk of isolation. If you have a hearing loss and don't do anything about it, there's an increased risk of things like depression, cognitive decline, communication difficulties. And with all of that is to say there's many reasons to prioritize your hearing and communication. And what we find is that when people get hearing treatment or tinnitus treatment, after they've adjusted to the treatment, they are so glad they did, and it makes a big difference in their quality of life.
Sure. Well, thank you so much for joining me. Are there any last words or advice you would like to give?
Yeah, for those who have tinnitus ringing in the ears, there's absolutely something that can be done about it. For those who have hearing issues, it's important to work with an audiologist who can get you the right treatment. And my team at treblehealth.com, we're an independent group of audiologists. We specialize in tinnitus ringing in the ears. So if you know anyone who's dealing with this, whether it's affecting their sleep, their concentration, it's annoying them, it's really hard for them, please reach out to us. We offer a free consultation. Ask for Dr. Ben Thompson, and we'll get in touch with them and be able to help. So thanks so much, Mike. I really appreciate being here. It's been a pleasure.
And I'd like to mention he also has a good YouTube channel, so make sure to check that out, where he gives out lots of good information there that I only probably understand half of it, but that's my
Thanks, Mike.
problem, not yours.
Appreciate that, Mike.